Back in June, I had a chance to sit down with our Chief Medical Health Officer for a deeper look at how the pandemic was going 4 months in. On that day, the province had recorded 663 cases total, and just 23 cases were active. Now, the situation in Saskatchewan has changed pretty significantly, and joining me once again is Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. Thanks for being here.
Yes, hello. Pleasure to be here.
We know the case numbers are for sure different from when we talked back in June, but in your opinion, what's been the biggest change since things started back in March?
So obviously, as we discussed in the summer, March, April, a new virus, a pandemic, we didn't know much about it. We went into a bit of a slowdown or lockdown. And we saw some numbers primarily due to international travel and then some community transmission. But because of our fairly significant measures overall, our curve became very flat. And then over the later part of the spring, we very quickly started reopening. And by midsummer, we had opened most activities that we could enjoy, both work and leisure, but with some guidelines in place, like for restaurants, bars, gyms. And, that was quite successful. The numbers remained fairly flat, around, 10 to 15 per day. We did have a couple of significant outbreaks, in the Northwest that, required a lot of leadership from northern leaders, a lot of, surge by the Saskatchewan Health Authority, but that was brought under control. Some other outbreaks in community living settings, in different focal parts of the province. But overall, our numbers remain low. But we did expect that, with more and more people now out and about, we'll see a bit of an increase, and the case numbers went to around 10 to 15 um, uh, per day, and some of those cases were linked to interprovincial travel, some to limited international travel, and then of course in September schools reopened. That's a big sector, around 220,000 students and staff altogether going back to school, and that was very successful. We always said we will expect to see a few cases here and there, and so that has been as expected. But then we were obviously now in September, October, looking very closely to what is happening in other parts of Canada, in other parts of the world, and everyone was talking about, will we see a fall surge, which we did start seeing in many other parts of Canada, not so much in Saskatchewan. Um, but now we have seen several things in Saskatchewan. One is, of course, we have seen a few, large super spreader events that kind of have a snowball effect. Once you have a super spreader event, it's not just the 50 people who were exposed at an event and test positive. Then the secondary transmission in households or their places of work, and that generates a snowball effect that goes on for 3 or 4 weeks before it comes under control. So there's just a caution that the guidelines are there for a purpose, and we absolutely have to adhere with them. Not more than 15 people in your house, but as small as possible, not more than 30 at a reception. If you're going to a place of worship, to a bar, restaurant, follow all the guidelines. It's not just the business owner's responsibility; it's all of our responsibility to follow the guidelines. I've certainly been talking more about mask use as well, as we know that that is one of the layers. It's not the only thing we should do. Staying home if you're sick, wash your hands, keep your physical distance, and when you're in an indoor public place, wear a mask. And what that does is it actually protects others, and if others are wearing masks, it protects you. So there's a two-way protection. It's not just for yourself; it's for others as well. And we do have to be considerate. And now is the time, really, that the expectation should be when you're in an indoor public place, you should wear a mask. Certainly in any indoor retail location, and even in bars and restaurants, it sounds kind of counterintuitive that you're going into a restaurant with a mask on. What does that mean? But the staff are wearing a mask to protect you. They see hundreds of customers a day. So if you wear a mask, you're protecting them, and then you sit at your table, they'll take your order, they'll serve you, and once you're ready to eat, you can take the mask off. But once you've eaten, you can put your mask on to chat for a while, wait for the bill. That way, you're protecting even the people around your table if they're not part of your household, for the most part, except while you're eating and drinking. And similarly, you're protecting the staff and people around you. Everyone is 2 meters apart, but if you're going to the washroom or going to your table or leaving your table to leave, wearing a mask is an added layer. And every little bit counts. Everything we do, there's good evidence that all these layers can by themselves bring our case numbers down by 50, 60%. So we won't go down to zero. for a while, and of course, we just have to live with COVID. But as long as we can keep our numbers low and prevent those broad slowdowns or shutdowns that have such an economic impact, I think we want to live with COVID over the fall and winter, be able to continue doing the things we enjoy, and but following the guidelines. And I think that would be my main message at this time. That what's different from the spring and from the summer now that we're in the fall. Thanks.
Last time we talked, you were very certain we would not go back into lockdown, but that we'd see more masking required indoors. But we still don't have a mandatory mask mandate in Saskatchewan. What would have to happen for something like that to be enacted, even in just specific hot zones?
So we've obviously looked at what other provinces have done. Some have had provincial mandates since the summer, and it does normalize mask use. It does socialize mask use, and some have now had provincial mandates. I think four or five provinces have provincial mandates since fall. A couple of provinces had in the summer. 2, 3 provinces have had them in the fall. Provinces who don't have a provincial mandate, like you said, have had to apply it locally in case of a surge in cases. But generally, I think all provinces recommend mask as an expectation now in indoor public places. That's what I recommend. So I think we can look at how things are going. But certainly, I think it should just be a normal part of when we're out and about. And I've been saying since the summer that we should all buy masks, have them for ourselves, our children who are going to school. We should practice wearing a mask at home. Sometimes there's some shyness, some you're self-conscious about wearing it. We just need to get into the habit, and we shouldn't really have to think, okay, I'll wear a mask in this indoor space because I may not be able to keep physical distance, and this retail location maybe there's lots of space. I think we need to get over that. Just put your mask on for the 20 minutes, 30 minutes you're in public area, and then take it off when you're back in your car or on your way home outdoors. I think we just need to normalize mask use over the fall, and the evidence shows that it actually does have a significant impact on transmission. It can reduce illness, it can reduce severity of illness. The science really is very strong on mask use.
If you want to normalize it, why not make it mandatory? If we know that it's proven to keep people from getting sick, it could prevent more deaths in our province. Is the concern enforcement? Like, why not make it mandatory?
Yeah, it's enforcement, and I think we could certainly say that things that are common sense should be mandatory. But I think we have done so well on things like physical distancing, staying home when we're sick, all through the spring and summer. So I think if we can just do this as the thing to do right now, in my view, that's the best option. But certainly our mandatory could be considered, but it's a broad population level intervention that all of us should be doing. And while it can be considered, my recommendation currently is that we should just get on and use a mask whenever we're in an indoor public place. But again, we certainly need to flag all the areas if people are not clear. I've said recently that even when you're getting into taxi cab, the cab driver is wearing a mask to protect you. We owe it to all these frontline workers who have been working constantly. Everyone doesn't have the luxury to work from home. Everyone doesn't have the luxury to stay away as a choice. And we need to protect all our frontline staff, healthcare, essential workers, personal care services, retail, taxi, transit, as we get into the fall.
I know there were a lot of concerns about kids in schools being mandated to wear masks for 8 hours a day. I think largely that's gone pretty well. Why don't we have the same expectation of adults?
Yeah, actually, that's a good point that if we want to learn how to wear a mask, we should probably ask a sixth grader or, teach our kids how to do it, because kids certainly have been very required being wearing a mask very successfully. I know in older grades, in some cases, they wear a mask even in class, and it shows in the numbers. We have children going in school, back to school now for, I think 8 weeks. We've had about 85 or so cases in about 65 schools. In most cases, majority, it's just one child who actually got exposed out in the community and then went to school for a day or two and then was tested positive, stayed home, close contact, stayed home. But because schools have all these layers, staggered start stop times, staying home if you're sick, physical distancing, hand hygiene, and mask use. It shows in the numbers we haven't had so far super spreading events, large outbreaks, and so there's the evidence for us that we need to apply for workplaces. I've talked about workplaces now more and more. That some workplaces have been great right from the beginning, physical distancing, mask use right from the beginning, from March. Some have started off very strong, kind of lagged in the summer. They really need to pick up their COVID practices again. And some really, maybe especially if they were not public facing, they were not dealing with customers, may not have ever gotten around to it. I know many workplaces where you can work from home or remotely are doing that, and they should continue, or go back to working remotely where they can, because reducing the density or the crowding in transit in all those areas, every little bit counts. But certainly in workplaces, what we've seen is that if you're sitting at your desk, if it's an office environment, you're fine, you don't have to have a mask on. But if you go into the washroom, coffee area, put a mask on. Sometimes you may get together for lunch, and you may not maintain that physical distancing. You may be carpooling. If you have to carpool, you should wear a mask in the car. Those Your colleagues are not part of your extended household or your bubble. And similarly, socializing after work. So workplace exposures don't just happen at work, they happen while coming to work, going home, and socializing during breaks or after hours. So I think that's a whole area that I think we need to pay attention to, because many of us are back at work, and schools have been successful. We need to focus on workplaces, restaurants, bars, gyms. We've had a few super spreading events because there was lack of compliance with guidelines, or because the guidelines are being followed, but there was some crowding that was happening, or really, it can happen. The guidelines don't mean that there'll be no transmission, but we need to keep transmission events to small numbers, not large super spreading events. But again, just being conscious of the guidelines. And when our reopen Saskatchewan guidelines were published in over the summer, I said read the guidelines, and I think we should read them again. I certainly read guidelines for restaurants, bars before I go. I read the fall guidelines for Halloween again, just yesterday, and it's always good to review them. They are pretty detailed, and if we all follow them, I think we can hopefully navigate this and keep our numbers as low as we can. Certainly, they are now trending up. We're around that 60 average of 60 cases a day now, around 5 per 100,000. So that was my first threshold, that we should now start paying it great attention to COVID. And of course, we want to keep it as low as possible. But certainly, they're trending now upwards and are in that 60 per day average now.
What's been the biggest surprise with how this virus has spread in our province, or has this played out so far the way you expected?
Yeah, well, a couple of things we've learned about COVID is that, we can obviously, to large extent, control transmission with these specific measures. And they don't come easily. It's learned behavior, keeping that physical distance, wearing a mask. But, when we do it consistently, we can keep our numbers down. Um, and we've also, the literature has also showed, and we've seen in our own experience, that in some cases, you can have these super spreading events, and sometimes it's obviously crowding, congestion, being on a dance floor, which really was never allowed. And there's a public health order that's been issued yesterday, which really specifies that. Um, but there are situations with this crowding, whether it's in a nightclub type situation or in someone's home, with this rapid transmission. We've had events where, when we had, a limit of 30, 28 people on Violate and 26 got COVID. And that's because of the close interactions that we were used to. And we really need to keep our distance and continue to meet virtually where we can. But even when we're meeting outside our household, try to maintain that distance. Even in our homes, when we have, a couple of friends over, maintain that physical distance, plate food out if you're serving refreshments. So, we can control this, but we have to be very consistent with the practices. So I think it does transmit rapidly if we don't pay attention, but if we pay attention, we can control it. So I think, it's a high risk COVID, and we've seen it spiral out of control again in many parts of the world. But we can control it, but we need everyone to pull together. I think we can't just have 50 or 70% of the population pulling together. all of us can, all of us need to.
Can we talk about the tighter restrictions? Across the country, we've seen the effects of Thanksgiving gatherings. Why was the decision made after Thanksgiving to reduce gathering sizes down to 15?
So I don't think there was just one reason, but we were looking at the gatherings in the households. And for Thanksgiving, the feedback I got was that many families were already very careful. Many families had told their family members from out of province to not visit this year. Some did visit, or some did go to another province. But we did remind to keep your gatherings as small as possible. But in a few cases, we did see a bit of a signal where people did go to more than one gathering, and there were some transmission events. But when we looked at not just Thanksgiving, but also increasing trend in numbers, and when we measured the fact that most households really can't have more than 4 people in a living room, where ordinarily you could have 10 or 12. If you invite 4 friends over, one part of your extended household, you really can't keep that 2 meter distance unless you just have a limited number of people. So from that point of view, we did go down to 15, and we'll have to continue to revise that. I think 15 is a good number, but it doesn't mean all of us should always have gatherings of 15. I think most of us can do with not having any gatherings at all at home, and we can meet with our friends and family at a restaurant. 6 at a table. We can meet outdoors, going for a walk instead of inviting someone for a meal. We need to look at all these things and options, keep a number small, consistent. But certainly at the moment we're at 15, and for receptions at 30, but we'll have to see where's the transmission happening. And it's happening in small birthday parties still, it's happening in small wedding receptions, it's happening occasionally in work settings. So it's a bit of everything right now, apart from that few super spreader events. So we'll have to keep monitoring and adjusting our guidance and public health orders as required. But we do want to avoid as much as we can large sector-wide slowdowns or lockdowns. That has an economic impact, it has an impact on livelihoods, on businesses, on mental health. So we want to avoid that as much as we can. But then we have to do everything else. We can't have it all, and so we have to then be more consistent with our gatherings at home, following guidelines at work. But we'll have to monitor. I think we have to monitor everything on a week by week basis and adjust as required.
Young adults are accounting for a lot of the cases. Young adults are also the people that are probably most likely to celebrate Halloween this weekend. I know you've talked about this before, but what are some of the top things people should consider when it goes into Halloween weekend?
Yeah, so first of all, I want to recognize that young adults are also, in many cases, out working at, service-oriented jobs. So they may be serving us in restaurants and bars, and doing lots of work as well. So exposure can happen while you're socializing, but also when you're working. So I think we need to recognize that, it may be due to a variety of factors. But certainly, I think, we do recognize that, even as young adults, if you're out with friends, maintain it to a small, consistent number. For Halloween, for children, of course, we said, it's fine to go trick and treating, stick to your household, stick to your neighborhood, go to just a few houses who are, involved in trick or treating. As older adults, if you're planning to have a get together in a bar or restaurant, follow the guidelines, go with your consistent group of friends, 6 to a table. Don't go bar hopping. That's my recommendation, because if one person in a party is infectious, it's bad enough having a transmission event in one, venue instead of several venues. So really, stay in one location. I think that's my strong recommendation. The proximity tracking app is a very useful tool, but all of us have to have that downloaded and activated. It doesn't work if only few of us have. So I think this is a good time for us to have that downloaded and activated. It takes 2 minutes to download and activate. If there was a transmission event, it helps you get notified quickly and anonymously. But I think we do need to be careful. We don't want Halloween to be a reason for another surge a week or two down the road.
The new public health order around nightclubs and bars comes into effect tomorrow in Saskatoon. What are some other restrictions that you're considering if that does not bring the numbers down?
It's going to be very challenging. We knew that as the weather gets cold and as we move indoors, our risk of transmission will go up. And certainly our community transmission now is much higher with 666 plus active cases, with around an average of 60 cases, new cases every day, plus minus a few. It's a very challenging environment, and if we do everything that we can and our numbers remain around this 60 mark and hopefully start coming down, I think that's the best outcome. If they keep trending up, I think we'll have to look at the transmission settings. I think they may be very different in the far north and north, where it may be more private gatherings and those kind of settings. In Saskatoon, there were some super spreading events in nightclubs, hence the order. In Regina, I'm in daily conversations with medical health officers. It seems to be not the same as in Saskatoon. It seems to be a variety of, some international travel, interprovincial travel, some transmission within households. There may be some crowding. And again, if people are living in crowded situations and if they need assistance for, isolating outside their household as a case or a contact, public health can assist you with that as well. Um, so Regina's situation is a bit different. We've seen in Yorkton, they had a bit of a exposure event at a gym, and then several other workplaces were impacted. Another outbreak, another workplace, they had high case numbers, but through quick action with public health, everyone had a list of contacts that is given. Businesses worked very closely with public health, and they quickly turned around, and now they're stabilizing. So things can go up, but then they can also turn around very quickly. So that's what we are hoping for. But of course, if numbers keep trending upward, we'll have to look at where's the transmission happening and what can we then, how can we slow that down, either through recommendations to the public, to businesses, or if required through changes in the reopening guidelines or through public health orders.
In regard to testing, we've been told many times the daily goal is 4,000 tests per day, but it seems capacity is a bit of an issue. People are waiting 3 to 5 days for results. When numbers have been steadily increasing, is that giving us an accurate picture of what's actually going on in the province today?
So I think several things here. One is that we don't look. We have already known from serology surveys that the actual number of cases at the volume of testing we are doing is about 4 to 5 times higher, because provinces that have participated in serology surveys, including Saskatchewan, our estimated serology positivity rate is 4 or 5 times higher than our total case numbers. So we already know that, because many people are asymptomatic or so mildly symptomatic they never get tested, and that's why we have to practice everything all the time, not when someone is sick, because you transmit before you become symptomatic and 2 days afterwards. That's your peak transmission. We have to practice physical distancing, mask use all the time. So that's the one thing. And the second is, testing obviously needs to be done in a way that you should isolate when you are symptomatic, and it doesn't matter when you get your test results, but you should remain in isolation. And if your test results are positive, you continue your isolation for 14 days, and your close contacts then isolate for 14 days. If your test is negative, you still isolate till you're symptom-free 48 hours. So that should be a routine, irrespective of test results or whether you get tested or not. So I think that's really important. And then, of course, contact tracing. We need to help contact tracing colleagues. They've been working flat out now for 9 months, have become really busy. We all need to have a list. Every weekend, I make a list that who was I in close contact with the last 2 weeks. I have that list ready, so that if I was to become a case, I would have a list ready to give to public health. And we should all have in our mind, who were we closer than 2 meters for more than 15 minutes. Really shouldn't be anyone outside your household, and maybe a few of your close friends, your extended household, as long as everyone has the same close friends. Beyond that, there should be no one we can say that there was a close contact, whether we went shopping or at work. No one should be considered a close contact, and that's how we should behave. Because otherwise, it starts getting very complicated. Because then that's also a factor in increasing transmission. If we have many contacts, and if in fact we don't even know who our close contacts were, because we were in situations where there's congestion and no one knew who was who, and we really need to avoid those kind of settings. Even if you're invited to an event where there's more than the recommended number, we should either help the host to straighten things out or choose not to attend. I think um, you know, it's important that we actually work with hosts to make sure that if they weren't able to organize an event safely, we help them to organize it safely.
What would you say is the biggest challenge that public health is facing when it comes to contact tracing?
Well, the first thing, of course, is that our average number of contacts have gone up. Like, when in March, April, most co- most people who were coming from overseas, international travel, their only contacts were people they were traveling with, or people in their house when they arrived. But when they were quarantining, even people in the house were staying away. So the number of contacts were one, two, three, less than four. Then they went up to eight on average, and they're already still trending in that 8 to 10. But the range is very wide. Some people have 200 contacts. That's really unacceptable. How can you have 200 contacts in this in this time period? So most people are keeping the contacts low. Average is eight. The median is also around that 8 9. But some people really I think are not realizing that they're generating a lot of content, so they just need to change how they conduct themselves on a day by day basis. And again, I would say that in situations where you may not know who's your close contact, because if you go to a grocery store or bar restaurant, we always issue a public service announcement, because sometimes you can't know who you may have been in close contact with standing in line or in an aisle. But the proximity tracking app is a powerful tool that's underutilized. In many parts of the world, it's a requirement. You must have it. In many parts of North America and Western Europe, it's not a requirement. But I think really, if you are out and about, all of us should have that downloaded and activated. It's anonymous, but if you have become a case, you put in a code and your symptom onset date, so it lets anyone who may have been in closer than 2 meters of you for 15 minutes, who also had that app downloaded, they get a text that they should consider self-monitoring, and if they're symptomatic, get tested, and isolate and talk to public health if they need to self-isolate. So I think that's a tool we should increasingly be using. If we continue to have high cases and continue to want to be out and about.
We were the third province to have an election in this pandemic. In your opinion, how did the protocols and the process go from your end?
So, my role was to work closely with the chief electoral officer to make sure that whenever elections were to happen, they would happen in a safe manner. And so, I think the chief electoral officer and all the staff uh, worked extremely hard to conduct elections in a safe manner. And, as far as I could see, the advice that we gave was followed. And so I don't have any concerns with any consequence from the conduct of the elections. I think generally, they were done in a very responsible way in terms of the organization of the voting, participation in pre-election activities, and the actual act of going and voting. So, I think that's an example of a very large, significant event happening very safely. And I know they've happened in two other provinces in Canada as well. So, it's not a small feat to hold provincial elections during a pandemic, but I think I'm quite um, uh, satisfied with how they were conducted.
How did you find the information sharing process with the public through the period where the government has been dissolved?
So I think in my case, my media updates, actions I had to take continued in my role as the chief medical health officer. Obviously, the government still is in place through the deputy minister. So I would, routinely brief the deputy minister at that level of government. So, from my side, we kept everything the same as we were in terms of updates to the public, any decisions that need to be made. And so I didn't see a lot of challenges from my side. But of course, our numbers were also pretty stable, but they have been picking up now recently. So, I don't think it's so much a matter of, in my view, whether we were in a pre-election period or not. I think it really is, in my capacity as chief medical health officer, looking at the data, looking at the numbers, and giving the best advice to government, but also to the public. I think that's a dual role, and I feel I kept doing that throughout the election period.
We've heard COVID fatigue is having an effect on people's behavior. We're seeing that in other parts of the world. Are you concerned about what will happen as we get into the depths of, well, really cold winter here in Saskatchewan?
So a couple of things. One thing is that, I've always said that this is a marathon, not a sprint. I've been saying that right from the beginning, and we need to pace ourselves. We need to take time out for ourselves, enjoy and relish the simple things, not get worked up over things that we can't change. We can't change the fact that we shouldn't be traveling internationally. There's lots of things we can't control, and we shouldn't constantly get worked up over that. Not get worked up again and again if someone asks us to wear a mask. Just go with the flow. I think that's really important. Stay calm. And we have uh, I think from what I can see, many businesses, many opportunities remained open through the summer. Even for mask use, we saw that our numbers were very low, and in the summer I said we should all get into the habit of wearing a mask, but I didn't really recommend it that strongly in the spring and summer because we had very low rates of community transmission, and this remained low when we were outdoors enjoying the outdoors. But I was signaling that we all need to have several masks at hand for every household member in the fall and get in the habit of putting them on when we go to indoor public places. So now the time has come. So all of that is just to modulate our responses so that we don't get fatigued prematurely. But now is the time to wear a mask, routinely in indoor places. And the pandemic is not forever. We have had a very good run so far the last 9 months. It's very important reestablish best practices, including mask use, over the next 4 months. We can look forward to a safe, effective vaccine available early next year. Maybe I can't say the exact date, February, March. The vaccine will come in a way that it will be prioritized to high risk groups first. So it may take some time for the majority of the population to get vaccinated. But I'm hopeful that once spring comes, we will be coming out of the pandemic. Certainly, the state that we are in, and next fall won't be like this fall. But the next 2 to 4 months are critical, and I think we are now at a risk which we were not before, where we have generalized increase in case numbers. I think apart not focal outbreaks, yeah, we have had some super spreading events, but generally, if you look at our dashboard, we have active cases throughout the province. We have a high baseline level of community transmission, and that can take off very quickly. One poorly organized event, even a small event of up to 30 people, can then result in 30, 60, 90, 120 people, within 2 to 3 weeks. So we absolutely need to be very diligent about small events, even if they're allowed in the guidelines. Of course, there's no room for, trying to skirt the guidelines. And even in our day-to-day, whether we're going out to have a meal in a restaurant, when we're going to work, we need to either continue with best practice or reestablish them. I think now is our most critical time to establish those practices and not see a significant surge.
And before I let you go, I want to talk about you personally for a second. I know you told me last time we talked about how much sleep you lost in the beginning of the pandemic. How are you doing now? There is a lot of daily pressure on you.
Certainly we know much more. I know we know where we need to go, and the navigation part is more clear. We have our navigation maps, so that's very different from February 2019, February 2020. But it is a stormy sea now. I think it was calm waters over the summer, very calm waters. It's a stormy sea now, and we have to stay the course. And I think that's the way I would describe it right now.
So you're just riding a boat in a very stormy sea.
Well, we all are. We're all on the same boat, and it's getting rough. But we need to stay the course, and I think we can, as long as we all pull together, we can come out of it. But it needs all of us to pull in the same direction. I think it's not enough for 60-70% of the population doing the right thing. That is not going to get us through. It has to be all of us.
Thanks so much for your time, Dr. Shahab. Appreciate it.
Okay, well, thank you very much.
Dr. Saqib Shahab is Saskatchewan's Chief Medical Health Officer.